This first particular topic is really disturbing because we talked a lot on the show about how soda can affect your body. And this week, there's a new study out that's blowing the lid off of soda companies' real interest in public health. The study was released just Monday in the American Journal of Preventive Medicine. It was done by Boston University investigators. What they found was quite interesting. It claimed that large soda companies gave money to 96 health organizations between 2011 and 2015. That may not seem like a big deal, but when you see the list of these organizations, we're talking about American Diabetes Association, National Institutes of Health, the National Academy of Nutrition and Dietetics, the American Academy of Pediatrics, American Heart Association. The list goes on and on, but where things get really sketchy to me is this concept that then you saw maybe public health policy being swayed in the direction for what soda companies were seeking to achieve.
Lobbyists to promote their business, very similar to what the tobacco industry was doing it. But
you know what I see is that the more the government cuts the budget for the NIH and for these organizations, the more they need outside help.
It's very true.
So if the government doesn't support these things and we pay that in our taxes, then they've got to say, well, we got to get the money from somewhere, and so they're going to take it, and that does compromise.
So who do you think is at fault here? Because I will say this, there are a couple exact examples where they think the money given into a healthcare organization or health organization directly influenced, for instance, maybe the a tax on soda was on the agenda and that tax was not passed. So do you think that the soda companies are to blame for this, or the health organization should just say, we're not going to take your money?
Well, yeah.
I mean, I think it's both. Like you said, if somebody's giving you a donation and they need the money, I mean, what are you supposed to do? I mean, the right thing would say, no way we're going to take your money because you're the cause of so many of these disease processes in the first place.
And the candidates, the same thing. They have to. They take money from corporations and from institutions, and you say, well, no, we can keep arm's length, and I won't be swayed by that. But
is that true? There has to be some sort of payback.
All right, in 2010, Philadelphia proposed a soda tax. The beverage industry gave $10 million to Children's Hospital of Philadelphia for the city to drop it. Wow. You know, that's where, to me, things get really sketchy.
We've been on our 9th season. We have talked about the deleterious effect of sugar, bad sugar, in all its forms for years and years now, and we have tried to hit home the point with sugary drinks. I mean, we've had the visuals with, if you drink soda on a regular basis, you're going to consume this many bags of sugar. But people still don't get it. They don't realize how much sugar, how bad it is, and how addictive it is.
Well, and it makes sense that the wool has been pulled over the public's eyes to some extent. I don't blame the beverage companies. At the end of the day, they're just trying to promote their products and what's in their best interest. They're corporations. But when you start to influence public health policy with, I'll call it dirty money, again, getting back to the tobacco industry, a lot of dirty money was thrown at people to create studies that showed tobacco wasn't all that harmful.